Welcome to Union Hospital. Founded in Terre Haute, Indiana in 1892, the original Union Hospital structure was a two-story wood frame home. But from those humble beginnings, Union Hospital has grown to become the Wabash Valley's leading medical center and the largest healthcare provider between Indianapolis and St. Louis. Now with more than 2,400 employees, Union Hospital and its Terre Haute campus have evolved into a major medical center with facilities for physician offices and physical therapy, an ambulatory surgical center, and a comprehensive cancer clinic that includes the Clara Fairbanks Center for Women. Among the inpatient and clinical services housed in the 500,000 square foot east wing of the hospital that was opened in 2010, you'll find the emergency department, Da Vinci Surgical Suite and adult medical and surgical services, the intensive care unit, imaging and respiratory therapy, along with 380 private patient care rooms. Union Hospital's West Wing houses maternity and child services, including labor and delivery and the area's only neonatal intensive care unit, cardiovascular services, pharmacy, rehabilitation medicine, and the Wound Healing Center can also be found in the West Wing. Dr. John Bollinger is Union Hospital's Vice President of Medical Affairs and Chief Medical Officer.
Well, I think, one of my dreams is for this to be more of a referral center than we are even at this point. But we have all of the major medical specialties covered in our medical staff. I think some areas that I think we're exceptional at is the area of cardiology, cardiovascular surgery, our orthopedics and joint replacement programs. These are all programs that I think we can really spotlight, and we're second to none as far as what we're able to provide to our community.
We look for well-rounded individuals. Obviously, strong academic background is important, but well-rounded rotation experiences and an interest in community rural health. We also pride ourselves, though, with a big teaching aspect with the medical residency that we're partnered with, and we also have a huge academic portion. So someone who's looking to advance themselves clinically, but also stretch themselves professionally outside the realm of just pharmacy practice.
We're a very strong program as far as the clinical experiences that we provide. We've got a strong emphasis in adult medicine, critical care, and emergency medicine, as well as some good electives, cardiology, oncology, ambulatory care type of rotations. We have a really unique teaching experience, so if you are interested in going the academia route, we offer a lot of teaching opportunities, not just to pharmacy students, but also to medical residents, PA students, psychology students at ISU. So I think we have a really strong teaching experience as well.
When I was applying for residency programs, I looked into a lot of things, the size of a program and how the preceptors were. When I interviewed here, I was sold. I wanted to come here because we have a very cohesive group and they had best interest for the residents, and we have a very flexible program as well, and they will tailor the rotations based on residents' needs and interests. That's what brought me here.
Union Hospital is an accredited chest pain center, a certified primary stroke center, is the home of the Terre Haute area's largest joint replacement center, and the Wabash Valley's only Level 3 newborn intensive care unit. Union Hospital offers accredited cancer care, along with accredited medical and stroke rehabilitation programs. Union Hospital's strengths are many, among them location.
Big enough that there's things to do, good-sized hospital that we get to see a wide variety of disease states. A lot of smaller hospitals feed into us, but not too big that it's overwhelming, that you get lost in the mix.
Located in Vigo County, approximately 70 miles west of Indianapolis, Terre Haute, Indiana is a city with a population of just under 61,000. However, Union Hospital's service area encompasses Vigo and an additional 8 surrounding counties with a metropolitan area population of just under 250,000. Terre Haute earned its moniker of Crossroads of America decades ago because of the intersection of 2 major roadways in the city. U.S. Highway 40, which runs east-west from Maryland to California, and U.S. Highway 41, which runs north to south from Michigan to Florida. Terre Haute's location is particularly attractive for those who prefer the pace of life in a small city, but seek convenient access to major markets. Chicago, St. Louis, Louisville, Cincinnati, and Indianapolis are all within a drive of 3 hours or less from downtown Terre Haute.
Terre Haute's a nice family town. They've got lots of parks and recreational areas. The shopping is comparative from my perspective. So it's been a really nice transition for me and my husband.
Terre Haute is the home of Indiana State University. With its downtown campus located less than a mile from Union Hospital, Indiana State boasts a student population of nearly 12,000 and offers more than 80 undergraduate and 90 graduate programs, which include the ISU School of Nursing and Scott College of Business. Terre Haute is also the home of Rose-Hulman Institute of Technology, rated as the #1 school in the country, offering a bachelor's or master's degree as its top degree in engineering. U.S. News & World Report has awarded Rose-Hulman the #1 ranking for 14 consecutive years.
It's a very well-rounded program, large enough to provide a lot of variety in terms of experiences, rotations. You see a huge variety of patients, backgrounds, and levels of acuity, but at the same time it wasn't so large that I just felt like I might be lost in the shuffle. Small enough that you can build meaningful relationships with physicians, nursing staff, and other members of the healthcare team, and also just really feel like you're making a difference.
We believe in you learn by doing, not learn by listening, so we like to have our residents thrown into with the wolves right out of the gate till they get that experience to become independent clinical practitioners. When they leave here, they're ready to go, take their board certification exams, pursue a PGY2 in whatever area they choose. We feel like we offer a very strong program to set someone up to be an independent clinician right out of the gate.
To serve our patients with compassionate health care of the highest quality. That's our mission at Union Hospital. If you would like to learn more about the Union Hospital Pharmacy Residency Program, contact Program Director Dan Cleveland at 812-238-4967 or by email at dcleveland@uhhg.org.